Good morning, everybody, and hopefully you can hear me. My name is Leslie Horton. I'm the Director of Yavapai County Community Health Services, and I'm joined today by Josh Goldman. He's our Public Health Emergency Preparedness Coordinator, as well as Sally Slater. She is our nurse coordinator and does a lot of the coordination of vaccine planning and will be the one in charge of administering thousands of vaccines across our county. And so go ahead and listen into the presentation. You're welcome to ask questions during, but I will be helped by Sally and Josh to answer those questions at the end. So go ahead and type those in if you have them, and we'll go ahead and get started. So this morning we have good news in that the emergency use authorization for the Moderna vaccine looks to be processing through the FDA, and that vaccine should be shipping out this weekend from its locations, as long as weather permitting. I think it's Midwest or back east where they're developing this, and so I know they've been hit with some pretty bad weather, but it doesn't seem so far to have slowed down vaccine shipments. So with that, and I'll explain a little bit more later, Pfizer vaccine was approved last week, and the state of Arizona, in a collaborative decision, decided that Phoenix and Tucson, Maricopa and Pima counties should receive the Pfizer vaccine. And I'll explain more about why, but the Pfizer vaccine is very difficult to handle, requires ultra low cold storage. And the Moderna vaccine that is being approved this week by the FDA does not have such extreme handling needs, and it's not as fragile as Pfizer. And so the rest of the counties in Arizona will be receiving Moderna vaccine and will only be just a few days behind Maricopa County and Pima County in the receiving of the vaccine. Yesterday, Maricopa and Pima both held their first drive-through vaccine pods. And so those went very successfully, and they were happy to start distributing vaccine out to healthcare providers, as they are the first priority group that is going to be receiving. So in this time frame that we've laid out, please keep in mind that it is going to have to be flexible, and flexibility is going to be kind of key to our planning process over the next several months, because we don't know yet how quickly vaccine inventory is going to come our way. We do know that it's in very short supply. And so far, we've been allocated 8,100 doses to Yavapai County in the first month, so December for the most part. The first couple of shipments of vaccine, we are slated to get 8,100 doses. As of next week, we should be receiving our first 3,100 doses, and then followed up by the remainder of that allocation in the coming weeks. So we're going to go ahead and get started with vaccinating and especially distributing that vaccine to our healthcare providers. They are our front lines of support for those who are sick with COVID, as well as are serving the most vulnerable in our communities. And so as you can see on this time frame, as of December, we're going to work on getting that vaccine to healthcare practitioners and technical occupations, healthcare support occupations, emergency medical responders. And then there's a Walgreens and CVS CDC pharmacy. It's a CDC partner program for long-term care that's been rolled out. So Walgreens and CVS are directly, they allowed long-term care sites like assisted living and skilled nursing sites to sign up to get direct service with vaccination through Walgreens and CVS. So that's been a great opportunity for many of our long-term care facilities. But then beyond that, there's several that didn't sign up for that program. So as we venture into January, hopefully we will have gotten much of the vaccine distributed to healthcare providers and others that need it on the front lines. But then we are also going to be working to find out which assisted living sites did not sign up for Walgreens or CVS and figuring out how to get them vaccinated. So in January, we're venturing into finishing out phase 1, they're calling it, of vaccine administration. And then also branching into phase 2. And so that end of phase 1 and phase 2 include assisted living, independent living, HUD housing, DES group homes for those with developmental disabilities and the staff in those sites, adults with high-risk medical conditions in shelters or congregate settings, law enforcement, corrections, national security, education, and childcare. So before we get to our essential workforce, we do have to vaccinate several thousand people. And the vaccine is optional. It's not going to be mandatory for anyone unless a workplace or location decides to do that. I recommend that if you're considering making the vaccine mandatory, that you consult legal counsel just to make sure that that is something that you are able to do. As of now, Governor Ducey has wanted to make sure that this is optional for anyone who wants the vaccine. So once we get through those first 2 phases of priority populations, then there is more along the lines of phase 2 that includes our essential workforce. And so that is what this presentation is geared for, is the essential workers. It's our power and utility workers, food and agriculture, packaging, distribution, grocery, restaurant workers, transportation and material moving, as well as government. And so, and as well as many other essential and critical trades. And so that is kind of vague in some ways. Some ways it's not. There's been a lot of clarity brought to who is in our essential workforce. But we will be working as a health department and with all of our community partners to work on scheduling and vaccinating as many folks among our essential workforce as possible, especially prior to moving on to general population. Beyond our essential workforce, there's other phases of priority, which include those over 65, those with underlying health conditions, those in corrections or incarcerated, as well as those in like recovery homes, other adults that are not necessarily high risk, but in congregate settings. And so we will be working as quickly as we can through all these, but like I said, it's all going to be dependent on the vaccine supply. And as I'm hearing from Maricopa County already, they're a little concerned because they're not necessarily receiving as many vaccines as they were promised originally. And so it may take a while. We do know that the supply is very limited. And so please remember that it's going to take us a while to work through all of these priority groups before we can get to scheduling the vaccine clinics for essential workers. Our goal would be that sometime between February and March, we'll be getting into those groups. We've been told to probably, consider the fact that it's going to be probably late spring or early summer before we can actually get to the general population after getting through all of these phased in priority groups. So go ahead, next slide, please. All right, so Arizona has a vaccine distribution plan. And like I mentioned, Pfizer vaccine has been allocated to Maricopa County and Pima counties. They're supposed to initially receive 212,550 doses of the Pfizer vaccine. So far, they've received a portion of that, but not the entire allocation yet. Moderna has been decided by the state and the counties to be allocated to our more rural counties like us. And we're supposed to have a portion of the 171,200 doses coming to Arizona. There are going to be direct allocations of the vaccine to the VA, and they are slated to receive about 700 doses either this week or next. And so they'll be able to go ahead and vaccinate their veterans that they serve, as well as the pharmacies. There's many pharmacies that have signed up to get direct allocations of vaccine, as well as all of the Arizona tribes. They'll be getting a direct allocation. If you want more information about the Arizona plan, I put the link down there. It's at Arizona health.gov, azhealth.gov, COVID-19 vaccine. And so if you want more information, it's there. Arizona Department of Health Services also has a ton of information posted, and they're going to have blogs available and other good sources of information on side effects and other things posted, as well as we will be posting many links to our website at yavapai.us/CHS. So as I've described, we're going to be working through this plan. This diagram on the right there just talks about, from the point of the CDC distributing and manufacturing the vaccine, how it's going to work down through all the ranks. And finally, at some point, and hopefully the very near future, we will be able to vaccinate the general population. But we want to make sure that we don't miss priority groups as we're working through them. And so the essential workforce does have a lot of different dynamics to it. And so once we get to that point, we're going to need a lot of cooperation from you to make sure that we can schedule vaccine clinics that are convenient in different areas of our county, as well as at some points in time, we might be able to do on-site clinics, depending on the handling and ease of handling of this new vaccine that we'll be receiving. So go ahead, next slide, please. All right, so the Moderna vaccine, and this one is getting its emergency use authorization currently this week, and it should be shipping out this weekend. And what we know of it so far, and we will receive a lot more information just as soon as that authorization is completed, we usually right away, within a day or two, receive all kinds of new information about the vaccine. Most of our planning processes statewide have been based on the Pfizer vaccine. We do know that this one's very similar to that one in that it is an mRNA vaccine. It has very similar parameters around it, but I'll explain some of the things that make it a little bit easier for us to handle than the Pfizer vaccine. So currently, it's shown to be 94.1% effective. And so that does mean that there's going to be a few people that receive the vaccine that don't have 100% immunity to COVID-19. And yet, for the most part, most people are showing very good results. In the 30,000 people that tried the vaccine in the trial period, it's shown 94.1% effective. There are some side effects when people receive the vaccine. Generally, the side effects have been worse with the second vaccine than the first. So the vaccines are given 28 days apart. I realize on the diagram that I put here, that was based on the Pfizer vaccine, which is given 3 weeks apart. The Moderna vaccine is given 4 weeks apart. The second vaccine dose can have a little bit stronger side effects than the first. They're exactly the same in composition, but what happens is with the first vaccine, after a couple weeks, you start developing about 60 to 80% immunity to the virus. But then that second dose at 28 days or shortly thereafter closes in that gap of immunity. And so that gives you that kind of closes in to hopefully give you between 94 and 100% immunity to COVID-19. And so that second one, though, the first one can cause fever, headache, and fatigue. The second one is a little more likely to have some of those effects, and that is just your immune system working to accept the vaccine and build up your immunity. So the side effects are common. They're unpleasant, but not dangerous. And so, the one thing that we can discuss a little bit too, and I know people have had a lot of questions, is there has been with the Pfizer vaccine a few very limited circumstances of allergic reaction. And so I'll explain a little bit more about that, but that has been very limited. I think it's only been 3 people so far have had a severe allergic reaction. Most people just have these very mild side effects. So the reason that we are going to be handling the Moderna vaccine versus the Pfizer vaccine in rural Arizona is because Pfizer requires ultra low cold storage of -80 degrees Fahrenheit. It requires to be on dry ice if you're taking it out of an ultra low cold storage unit, and it can only be stored on dry ice for 5 days. It can be replenished once, the dry ice can be, and then it has to be used within 10 days. That makes it pretty difficult for a lot of the areas in Arizona, especially our more rural areas, to get it out to those who need it and quickly administer it. And so Moderna can be refrigerated for up to 30 days. And that gives us that ability to get it out to the places that need it and the people that need it, and have a little bit more flexibility in our time frames for handling. Moderna is also shipped in much smaller packages of 100-dose boxes, whereas Pfizer comes in 975-dose boxes. So we do know that our hospitals were ready and able to handle Pfizer if it came in, but the 100-dose boxes are a whole lot easier for our smaller providers to handle and distribute and administer those shots to individuals within a short turnaround time frame. So we are expecting to get those Moderna 100-dose boxes next week, and then be distributing those out to healthcare providers. But other than that, the vaccine, like I mentioned, should never be given to people with severe allergies. That's someone who's had an anaphylactic reaction to medications or other things that in their life. So kind of an allergic reaction that would send you to the hospital. If you've had that before, they are requesting that we hold off on giving the vaccine to people who have had severe allergic reactions. And so if you have, we can try to answer some of those questions on here, but also consider waiting. They are doing some thorough assessments of the vaccines to make sure that they understand which components of the vaccine could cause those very limited but severe allergic reactions. And so we should know more soon. But for right now, as we're just getting started with administering the vaccine, if you are one that's had severe allergic reactions in your lifetime, it might be good to hold off just a little while before getting the vaccine. Pregnant women can take the vaccine. It's common to see fever in the days following the receipt of the vaccine or the receiving of it. And so they are saying that it's safe, though, for pregnant women to get this mRNA vaccine. It is not a live vaccine. And from what they've seen so far, it does not cross over at all into a fetus or a baby in the womb. And so that is, it's been probably limited in the 30,000 individuals that received the testing of the vaccine, but it is showing to be safe and effective for pregnant women. It can cause that fever just right after receiving the vaccine. And then immunocompromised individuals, especially those with HIV and other health issues that might be compromising their immune system, can be vaccinated, but they don't often react as well to the vaccine, and they are not sure exactly how long that immunity towards COVID-19 will last. And so that is an issue that they're trying to sort through also with immunocompromised folks. And they are still suggesting the vaccine, as COVID-19 can be very severe for those with a compromised immune system. However, we're not sure how long that immunity will last. And you know, honestly, with the general population as well, they're not exactly sure how long the immunity to COVID-19 will last. We do know that people who have had the active infection of COVID-19 oftentimes test antibody positive for a number of months after having the active infection, which shows that their body has some sort of level of immunity to getting that virus again. However, we are seeing a diminishing of those antibodies in some individuals after 4 to 5 to 6 months. And so we will see, as this vaccine has only been tested for several months now, how long that immunity actually lasts for individuals, and we'll know more over time. Next slide, please. All right, I've included this draft of the vaccine side effect policy that the Maricopa County actually wrote this up as they were addressing the side effects of the Pfizer vaccine. It's very similar side effects with Moderna, and so I included this so that you'd know what to expect when you receive the vaccine. And one of the things that is being seen in all the clinical trials is that it is common to have side effects, like I mentioned, more so after the second shot than the first shot. But the side effects are also more common in our younger individuals, those 18 to 55. This vaccine is not allowed to be given to individuals under the age of 18. And the side effects include, and the most common ones include fever, fatigue, headache, chills, myalgia, and arthralgia. Those are soreness or pain in the joints and the muscles. And so these side effects seem also to be similar to COVID-19 side effects. The one that I've heard does not occur with this, with the vaccine is the loss of taste and smell. So the reason for this policy is to kind of help our workforce to understand that there may be some side effects that crop up with this, but they should only last 24 hours to 2 days at the most. And so if you have other side effects like loss of taste and smell or a fever or any of these things that last longer than 2 days, you need to possibly consider that the individual has active COVID-19 infection, not from the vaccine, but from exposure to the virus either before or after receiving the vaccine. When you receive that first shot, it takes a couple of weeks to start building your immune system. And like I said, you don't have a solid immunity to COVID-19 until after the second shot, and you can still contract active COVID-19 infection. So if you have people who are exhibiting these symptoms, and especially if it's symptoms that last longer than a day or two and go on beyond 3 days, we need to also consider testing them for active COVID-19 infection. So, and excluding them from work. So just keep that in mind, just because you're in the process of getting vaccinated, that people can still get COVID-19 during that process. And especially with the rate of spread that we're seeing lately, we want to make sure that people are still monitoring their health and monitoring for those active symptoms of an active infection. So I'm going to pass this over to Josh Goldman, and he can take on the rest. Thanks.
Thank you, Leslie. So if your agency has not begun to do so already, we would encourage you to start surveying your staff in your agency to get a rough number of who is wanting to become vaccinated. We've put out a couple surveys, and we've seen everywhere from 80% of the population would like to get vaccinated to a hard 50-50. So if you could survey your agency as well to get a better idea of what your specific agency will be looking at, and that will assist us in our planning and coordination when we get to that point. With that, we will be working with healthcare partners throughout the county, as well as our internal vaccination staff, to set up group dates and times for vaccinating your agency and staff when we reach that point in the phase lines. People who have had the virus, who have had COVID-19, are eligible to receive the vaccine once they have recovered and aren't exhibiting any symptoms. And Sally, you can correct me, but I believe it's for a week after recovery of COVID-19. And to reiterate what Leslie said before, this is an optional vaccination. So this is not required. If you're looking to make it required for your agency, again, definitely consult with your legal team before proceeding. And this is offered at no cost to the patient. So Arizona Governor Doug Ducey has put down that all Arizonans will be eligible and able to receive the COVID-19 vaccination at no cost to them. There was talk of an administration fee built to insurance, but no patient themselves will be charged for the vaccine. Next slide, please. And we also want to talk, Leslie did touch about harsh side effects with the vaccine possible. So if you are looking at vaccinating a large portion of your workforce, it's recommended to tier that. So you're not vaccinating them all at once and losing a large portion of your workforce for a couple days due to harsh side effects. And we want to talk a little bit about promoting the vaccination yourself and individually and empowering the everyday citizen to protect their self, their family, and their friends. Get vaccinated. So choose to get vaccinated when it's available to you. The CDC, you can find the information on their website. It has a vSafe program, and it helps the CDC monitor for any health effects, side effects, so on after the vaccination. So we encourage you to sign up for that after you're receiving your vaccination, and there'll be more information at that time. Again, share experience with coworkers, friends, and family. Again, and we want to empower you to reach that herd immunity we're all looking for. So share it with your family, your friends, co-workers, even the people you don't like. And know the basics. There's plenty of information out there. We have a lot of information on our website and resource page at yavapai.us/CHS, as well as ADHS's website and CDC. And then we encourage, again, empower yourself by visibly showing that you received the vaccine with stickers, promotion on social media, etc. Next slide, please. Volunteer recruitment. This is a big one. We've received a lot of outreach from people wishing to volunteer within the community here at Public Health. We encourage that if you're interested in volunteering or someone else within your agency, please go to the state volunteer registration system. It's called ESAR VIP. It's an emergency system for advanced registration of volunteer health professionals. The benefit of utilizing the statewide system is that it creates flexibility for both you, the volunteer, and for the counties. So being the volunteer in a statewide pool, you have the flexibility if you're not able to be utilized in your county, you can be utilized in neighboring counties, and that also provides the benefits to the counties as well. I can find more information at azhealth.gov/volunteer. And there's information on our website with our daily notifications as well. Next slide, please. Thank you.
All right, thank you very much, Josh. And we, as always, have a YCCHS hotline number that people can call with questions. Right now, we are receiving a lot of questions on when people can expect the vaccine. That number that we give out is 928-442-5103. But I want to reinforce to everyone on this call, and we were trying to reinforce to the public as well, it's going to take us a while to get through these priority populations, and we will try to message out as clearly and effectively as possible kind of what our time frame looks like. However, it's going to be dependent on supply and our effectiveness in getting out to the populations that need it, as well as the healthcare providers that are willing to help us. We have a lot of healthcare providers that are willing to help us vaccinate individuals, but we do have to work through these priority populations first. And so our first allocation is 8,100 doses, which will reach 8,100 individuals with the first dose. And then we will be receiving weekly or biweekly shipments after that to keep replenishing the supply and getting out to more people. So we will have to give each person a second vaccination as well. So this process is going to be taking us a while, but we will also be devoting almost all of our time and energy to get people vaccinated. And we definitely see this as a turning point for COVID-19, as it's had some pretty dramatic effects on our populations. And right now our hospitals are full, and we're hoping that we can make this turnaround to get people their level of immunity that they need against the virus. And so, you can always go to our website for more information as well. And what I was going to mention about the clinics is, as we start setting up workforce vaccination clinics, we're going to make sure that we don't advertise those publicly. So we'll be getting with groups of essential workforce, or initially healthcare providers, first responders, and other groups We will not be publicly posting where we are giving vaccine or when, because we don't want public showing up to these vaccine clinics. We want to make sure that they're focused on the populations that need the vaccine first. And so as we get down to working through the essential workforce, we want to make sure that we can get with you and hopefully have contact information for people within your workforce that will be point people so that we can schedule vaccine clinics. We're going to go ahead and open a portal on our website where people can give us their contact information. And like Josh mentioned, we need to know from you how many within your workforce want the vaccine, and so that we can plan accordingly as we offer vaccine clinics. So I'd like to go ahead, and I can see that we have quite a few questions, and I'm going to have Josh and Sally help to answer those questions, and hopefully we can get through all of them. If you have more questions, again, put them in the Q&A chat on the right, and we will try to answer as many as we can. So,
okay, I can start. I can help. Kathy Kent with Area Agency on Aging is asking that they serve the most frailest homebound seniors. When do you think they would be able to receive this vaccine?
those seniors are in the phase 1C, as far as I've seen, which is right after essential workforce. And those are anyone over 65, anyone with underlying health conditions who is not in a congregate setting. So those would be coming shortly thereafter. I'm hoping by early spring, hopefully we can work into those populations.
Susan Lapis asks, is 8,100 the total? We will receive, and will other organizations be receiving vaccines?
Those ones that I listed will get their direct allocation, the VA, some pharmacies, and Walgreens and CVS partner program. But otherwise, we will be receiving or getting directly, we'll be able to allocate those shipments of vaccines directly to other healthcare providers in the community. So they might get a direct shipment from the state, but we are working to allocate those equitably across the county and making sure that the providers get what they need. That 8,100 is our initial December allocation.
I don't know, we got 64% positivity rate.
We will get more vaccine in January, but we're not sure how much yet. So we will be getting regular shipments though, and additional allocations. That's just our first allocation for December.
Ted Ehrman is an RN, and he's asking, while the vaccine welcome is very limited, while Yavapai County has been in substantial spread in all three benchmarks for a while. Last Tuesday it reported that Yavapai County had a 64% positivity rate. And any other mitigation plans?
So I can speak to that one a little bit, and then Sally, if Wesley, if you have anything additional. Absolutely. The same mitigation plans that we've had in place throughout this entire pandemic, that we urge everyone to continue to do so, to include social distancing, wearing a mask, and proper hand hygiene.
Sally, you want to go ahead and take the next question?
Yep, I got that. Francis asked, how does a 94% efficacy rate compare with other vaccines that we are more familiar with, flu, shingles, and pneumonia? The answer to that is Shingrix is 89 to 97% effective, depending on the age of the person vaccinated, and Pneumovax is 60 to 70% effective. I have not yet this year seen the efficacy rates of the flu vaccine. Last year, it was only 40 to 60% effective. So it's highly effective. I got the next one too.
Okay.
Jen asked, what would that include people with allergic or with allergies to penicillin or reactions to morphine? From the information that we have now, a precaution should be used for patients with severe reactions to an injectable medication. So if it was an injection of penicillin with anaphylaxis, we want to use a very strong precaution against that, and maybe even defer that vaccine in those people. And again, morphine is mostly an injectable medication, so strong precaution with that as well.
Craig Rucker at IT support tech, would I be in phase 1 or phase 3?
I would say that would probably be phase. I guess it just depends. There's a lot of vague areas of essential workforce. So it's anyone who is critical to the moving forward of our communities and ongoing functions of government, of food distribution, of making sure that our communities have what they need to continue running even during times of a pandemic. And so if you can somehow find a way to justify that you are critical to the moving forward of our communities, that would be in the phase 2, which is the critical or essential workforce. Phase 3 is more general in terms of adults with underlying health conditions, anyone over 65, and those in congregate settings who are adults that are not necessarily high risk, but maybe incarcerated or in recovery or other congregate living settings. So I think that your IT support tech would likely be in phase 2 or possibly general population, depending.
The next question says, where will frontline home care workers go to obtain the vaccine? Does the home care agency need to register as a provider or provide proof to get them entered under phase 1?
That's a good question. Many of the bigger cities are looking to contract with someone to provide vaccine to home health providers, as well as those that are receiving home health. And so we are going to be looking into how many of those providers can actually vaccinate their own, or setting up clinics where we can go ahead and vaccinate those providing the services, and then figuring out a very careful way of getting the vaccine to those that are homebound or in home health.
Based on the resulted study released earlier this week, the Moderna vaccine may inhibit transmission of the virus. Once enough of the population is vaccinated, how long do you think the CDC will continue to recommend face coverings?
That's a good question. I have heard that there is no recommendation at this point anytime soon to remove the recommendation for face coverings, especially based on the fact that the supply is very limited of vaccine, that it is optional, and that we still are seeing high rates of spread across our entire nation. I can imagine that face coverings will be recommended for quite some time. I did see some news that some countries that have been able to manage their COVID so well, and now that they're getting the vaccine, will start beginning to move back on some face covering mandates and other things. But since it's not mandated nationwide, I expect that we will be recommending it for quite some time unless we get to a point where we know that we have a good level of herd immunity in the population to protect those most vulnerable, and hopefully start considering thinking about other things aside from COVID-19 quite so much. So somebody over there isn't muted. I think Terry is.
Hi, Lynn Constable asked, where will this WebEx be available? And we will be posting it on the health department website. Items has a question directed to Josh. If we survey staff on who wants to be vaccinated, who do we report that information to and by what date? Also, as volunteer-driven organization, our volunteers provide direct service. Can they be considered in the essential work pool?
So thank you. That's a couple of very good questions. I'm going to address the second part of that question first. So we are considering workforce all in one, paid or unpaid. So if they are volunteers working for your agency, they are still considered a part of your essential workforce. And to the first part of your question with the survey, one, thank you for the initiative and really jumping on that already. We are still in the planning phases with that. We will be sending out a link to appropriate agencies in the future where you can put that contact. And Leslie also mentioned that look for our website. There will be a portal available where you can submit that information as well, i.e. A main point of contact for your agency. And then again, rough estimate of your workforce that you expect to be vaccinated. And real quick, I wanted to address one question that came up a little while back too regarding IT. We do consider IT critical infrastructure. So depending on, of course, Leslie mentioned multiple nuances and gray area, but there's a good chance that IT could be considered and wrapped into the essential workforce of Phase 1C. Thank you.
All right, and I see there's a follow-up to the mitigation actions that Ted is saying are mitigation actions mentioned are less than effective as evidenced by escalating rate of positivity, hospitalizations, and number of cases. And so therefore, you know, the one measure that we haven't taken again, which I know no people want, is an absolute lockdown. And that is something that I don't believe our community leaders are considering at this point. Governor Ducey has come out and said he wants businesses to remain open. And therefore, we do ask people to use their best personal responsibility to do absolutely what they can to cut down on the spread of COVID. We know that there are measures that work if people will follow those measures. And so we encourage everyone to do their part, especially in your own workplaces, is a good place to really enforce those mitigation measures and wear masks where you can't physically distance. Do your best to keep sanitized and clean work environments and physically distance as much as possible. And we are hoping that this vaccine helps because as we've seen with this virus, it can be a roller coaster and comes and goes and sometimes affects us more or less based on how it is reaching our community. Right now, we are definitely seeing what it can do in a community, and as is the rest of the state, as is much of the nation right now. So we're hoping the vaccine does help in that manner. Then will the county provide free masks, hand sanitizer, and disposable gloves? And Josh, maybe you can answer that one since you've been distributing all those things.
So yes, let me read that. Free mask, hand sanitizer, disposable gloves spread out to the population. So yes, so we've been actively distributing PPE throughout the county during this pandemic, pretty much to everyone outside of individual households. Here recently, we have given large amounts of hand sanitizer and disposable masks to chambers of commerce to be distributed throughout the county. And additional to that, we have an active weekly PPE distribution to include hand sanitizer, surgical masks, gowns, N95s, the whole kit and caboodle to all eligible agencies. So that's all first responders, long-term care facilities, any kind of frontline health care. We even reach out to some local nonprofits and other agencies as well. So that is active and ongoing. In addition to that, absolutely, yeah, we will be looking to kind of talk on those mitigation efforts of providing free hand sanitizer and disposable masks and possibly other items as well when it comes time for county health-led points of dispensing with the COVID-19 vaccination.
Right, is there any other last minute questions? I think we've been able to get through the ones that you've had. Remember that you can call our hotline at 442-5103 if you have follow-up questions. We will be reaching out with more information as well as we know closer to the time frame at which we can offer vaccine to your workforce. And it helps us if we know how many people want it and can schedule accordingly for distribution of the vaccine. And so we do appreciate that each of you have taken the time today to listen in and ask questions and learn more about what our plans are and how we're going to get this Moderna vaccine out to the populations. There will be more vaccines approved shortly, but so far Pfizer and Moderna have the best and most effective, I guess, track record through testing. So we're glad to be getting vaccines that appear to be very effective in stopping the spread of COVID or stopping COVID infection. And we will see how well it does to help us stop the spread here locally. And so thank you. Go to our website. We will be posting this if you want to see it later, or if you have individuals who missed it, the live version, and want to view the video. So we will be posting it to yavapai.us/CHS. And thank you all for your time. I hope you all have a wonderful day.